Adalimumab, also known as Cyltezo, cf. Pen Psoriasis Starter 40 mg per 0.8 ml subcutaneous kit. Inflammatory bowel agents, is used to reduce pain and swelling caused by certain types of arthritis, such as rheumatoid, psoriatic, juvenile idiopathic, and ankylosing spondylitis. It is also used to treat skin disorders like plaque-type psoriasis and hidradenitis suppurativa. This medication works by blocking a protein called tumor necrosis factor, TNF, in the body's immune system, which is responsible for causing joint swelling and damage in arthritis, as well as red, scaly patches in psoriasis. By reducing joint swelling, Cyltezo helps to prevent further joint damage and preserve joint function. In addition to arthritis and skin disorders, Cyltezo is also used to treat certain bowel conditions like Crohn's disease and ulcerative colitis, as well as a certain eye disease called uveitis. It is important to take the prescribed dosage of Cyltezo at the optimal timing recommended by your healthcare provider to achieve the best results. Before starting Cyltezo, cf. Pen Psoriasis Starter 40 mg per 0.8 ml subcutaneous kit. Inflammatory bowel agents, it's important to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. If you are using this medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional and the product package. Before using, visually check the product for particles or discoloration. If you see either, do not use the liquid. If you are taking the medication out of the refrigerator, leave it at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication in any other way, such as by heating in the microwave or placing in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed. Inject this medication under the skin on the thigh or abdomen as directed by your doctor, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule/higher dose at the start of your treatment. Carefully follow your doctor's directions for using this medication. Make sure to learn how to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. Tell your doctor if your condition lasts or gets worse. Some side effects may occur at the injection site, such as redness, itching, pain, or swelling. If these effects persist or worsen, inform your doctor or pharmacist. Remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you notice signs of infection while using this drug, such as a persistent sore throat, cough, fever, chills, night sweats, difficulty breathing, painful or frequent urination, unusual vaginal discharge, or white patches in the mouth. Also, inform your doctor right away if you experience serious side effects such as irregular heartbeat, new or worsening symptoms of heart failure, blood in the stools, changes in mental/mood, severe headache, easy bruising or bleeding, leg pain or swelling, numbness or tingling in the extremities, difficulty with speaking, vision changes, joint pain, or a butterfly-shaped rash on the nose and cheeks. Adalimumab may rarely cause serious liver disease in people exposed to hepatitis B virus. Your doctor may order blood tests and monitor your symptoms during and after treatment. Seek medical help immediately if you experience symptoms of liver damage, such as persistent nausea/vomiting, loss of appetite, stomach/abdominal pain, yellowing of the eyes/skin, or dark urine. In addition, seek medical help immediately if you experience very serious side effects, including seizures or chest pain. While rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you notice symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of potential side effects. If you experience any other effects not listed, contact your doctor or pharmacist. In the US, contact your doctor for medical advice about side effects. You may also report side effects to the FDA or at www.fda.gov/medwatch. In Canada, contact your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. This medication can weaken your body's ability to fight off infections, which could lead to serious or even fatal infections such as fungal or bacterial infections, including tuberculosis. Be sure to inform your doctor about any past, recent, or current infections, as well as any travel to areas where certain fungal infections are common. Your doctor will also need to test you for tuberculosis before and during treatment with this medication. Additionally, there is a small risk, especially in children, teens, and young adults, of developing cancer due to this medication or your medical condition. It's important to discuss the risks and benefits of treatment with your doctor and to report any concerning symptoms right away. Before starting Cyltezo, it is important to let your doctor know if you have any allergies to Adalimumab or any of its products, as this medication may contain inactive ingredients that could cause allergic reactions. It is also important to discuss your medical history with your doctor, especially if you have had recent infections, blood or bone marrow problems, seizures, certain brain or nerve disorders, cancer, heart disease, or lupus. Cyltezo can increase your risk of getting infections or make existing infections worse, so it is important to avoid contact with anyone who has a contagious illness such as chickenpox, COVID-19, measles, or the flu. You should also let your healthcare professional know that you are using Cyltezo before receiving any immunizations or vaccinations, and avoid contact with people who have recently received live vaccines. It is important to use caution with sharp objects and to avoid activities that may result in injury while using Cyltezo. Before undergoing any surgery, it is important to inform your doctor or dentist about all the medications you are taking, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be at a greater risk for infections and cancer while using Cyltezo, so it is important to discuss these risks with your doctor. If you are pregnant, you should only use this medication if it is clearly needed, and if you are breastfeeding, it is important to consult your doctor before continuing to breastfeed while using Cyltezo. It's important to be aware that Cyltezo may interact with other medications, potentially affecting how they work or increasing the risk of serious side effects. This is not a complete list of possible drug interactions, so it's essential to keep a record of all the products you use and share it with your doctor and pharmacist. Do not adjust the dosage of any medicines without first consulting your doctor. Some products that may interact with Cyltezo include other TNF blockers, such as etanercept, infliximab, and other drugs that weaken the immune system, such as abatacept, anakinra. If you or someone else has taken too much Cyltezo, CF, and are experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can reach a provincial poison control center. It's important not to share Cyltezo medication with others. While using this medication, it's important to undergo lab and/or medical tests such as complete blood count and liver function tests. Make sure to keep all scheduled medical and lab appointments and consult your doctor for more details. If you forget to take a dose, make sure to consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. When storing your Cyltezo, CF, Psoriasis Starter 40 mg per 0.8 ml subcutaneous kit inflammatory bowel agents, it is important to keep it in the refrigerator, but do not freeze it. Some brands of this medication may also be stored at room temperature, so it's best to ask your pharmacist or check the product package for specific storage instructions. Once the medication has been stored at room temperature, it should not be put back in the refrigerator. Keep the medication in the original container to protect it from light and make sure to discard any unused portion of the medication. It's important to keep all medications away from children and pets. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.